Hi everyone, it's me Giri again, the host of Ask Giri the Physio Show. Today's topic is treat the man or women, but not the scan. Okay, that's the topic. It's an interesting topic and it's going to be short and sweet, and we're going to see why the CTs and MRI scans are important and also not so important. Let's dive right in there. Scan does not pick up or diagnose or treat pain. Because as a physiotherapist, right, we see a lot of people coming into us with pain, and also they'll come to us with this radiological finding report in their hand. Hey, you know what? I have L4, L5 disc bulge. Then I have this severe back pain. And they come to us. So how many of these findings are normal findings, age-related findings in normal human beings without back pain? You should know that. So we're going to dive deep into that to analyze what is the importance of the scans. Sometimes we do need scans. It's important for us to identify, you diagnose someone, you confirm the diagnosis with the radiological finding, and if it's something really a red flag, a disc, big bulge of disc is compressing the nerve really bad, patient is having a lot of neurological symptoms, scan is very useful to identify that cause and immediately refer to the neurologist or neurosurgeon. If the surgery is indicated for that person, it will be great. Or also to detecting cancers and tumorous tissues and hemorrhages. Very important, and that's very helpful for MRIs and CT scans. But most of the times in the musculoskeletal practice, it's the other way. Okay, we'll look into the next slide here. So, what does scan does to you, right? When you have a MRI scan, it creates the self-image of being damaged. Something is broken, something is torn, something, that kind of a feeling, which may not absolutely be the case, because even normal people have a tear, normal people have disc bulge, and they live without pain happily ever after, right? So this is what happens. First of all, you have fear. You see the scan, you see the disc bulge, your doctor is putting on the thing there and showing the, hey, here you go, this is the cause for your pain, L4, L5 disc bulge. He's showing you that, and immediately you get that fear, right, in your mind. So what that fear does, that limits your movement. You don't move that. When doctor says disc bulge, take care, don't bend too much, don't lift too much, then that gets stuck in your brain. Then you do not bend forward when you have a disc bulge. Then you avoid the forward bending movement. I've seen so many patients coming for an assessment with a low back pain. I'll ask them to bend forward. I can see the fear in their face. They don't want to do that. Yeah, that means fear of movement. Plus, you also something called fear-avoidance. You avoid certain activities and movement because of fear as well. So what happens when you don't bend forward and you don't move, when you are cautiously rotating, you're not using the range you have because of the fear of pain and fear of movement. Then your symptoms stays longer. Then your neurons in your brain goes, hey, we have to protect this guy, we cannot let him move. That's what's going to happen. Then that pain stays longer. Then we call it persistent pain. Then changes started happening in your brain, right? And then your past experience, your behavior, and also your pain, fear factor, everything is going to change how the neurons behave for the stimulus, any kind of stimulus. Then that becomes chronic pain. And then when you go back to your doctor, you're going to keep complaining about your pain. My pain is not changing. That's going to happen on the medical side? You're going to get more powerful painkillers. You start with gentle painkillers and anti-inflammatories. Every time you go, give the feedback that your pain is not going away, you're not able to sleep, you're not able to bend, you're not able to move, you're going to get a stronger painkiller. And again, after 2 weeks, you're going to get more stronger painkillers, which leads to opioids. And you know what happens, opioids, right? Get very drowsy, you can get addicted, and then a big crisis. We have a big crisis of opioids in Edmonton, in Alberta, in whole Canada. All the medical professionals are struggling how to get rid of this. It all starts from the basic pain neuroscience education at the primary level with your first initial consultation with any kind of musculoskeletal pain. Because 30 to 40% of opioid crisis originating from not properly treated musculoskeletal conditions or mismanaged musculoskeletal conditions like back pain, neck pain, shoulder pain. All these people, they follow this path and end up there. So that is one of my passion project coming up this year, that to kind of join hands with multiple physios to fight against opioids. So look forward for that information, and that's coming very soon. we will work on that as well. So I hope you understand this whole cycle, and then the cycle starts from that image you see on the film, then it gets stuck in your brain, and then it starts this cascade of things which you have to worry about. And it's up to you to break this cycle and come out of this. So treat the man and women, not the scan. So the next one I want to show you is a kind of nice image. The credit goes to Lee Darren. What he did is, there was a nice article in British Journal of Sports Medicine, BJSM they call it. They did a big article about what are the normal findings, right, in the people, like with the shoulder, knee, back and everything. And then they collected all the information and published in the study. So he did a nice infographic based on that for you to easily view that. Just spend some time looking at the slide and see. Disc bulge, they did 1,211 patients they scanned, and they found 87% of those people have disc bulge. The age group is between 20 to 70. See how normal the disc bulge is? If you find out that if you have a disc bulge in your neck or the back, are you going to be really worried, or are you going to talk to your physiotherapist about it? He's the right person for you to talk to educate yourself and understand the condition and the pathway, the treatment pathway. So when you get any scan done, don't sit with it and cry and whine about it. Just talk to your physiotherapist, get the clarity in your mind. That's very helpful. That is just a small example of the lower back. Then come on down to the shoulder. See, they scanned 51 men between ages of 40 to 70. Then they found 22% of the people have partially rotator cuff tear, right? So, yes, you might have a tear, you might have pain-free. Sometimes you have some pain, you might take an ultrasound, you might find the tear which happened a long time ago. What are you going to do about it? What are we doing about graying of the hair? What are we doing about wrinkles on the face? This is nothing different than that, right? So again, you see the bursal thickening, the subacromial bursa and all the bursas in your shoulder. 78% of the people had the thickening there, and 96% of people have some kind of abnormalities, right? And also come to the hip, the round shape of the head of the femur, which joins to your hip joint. There is always deformity. 37% of people will not have the spherical round shape in the head of the femur. And also pincer deformity is another deformity in that head as well, 67%. And labral injury, for 68% of the people have labral injuries. And now it's just getting worse because we sit a lot, right? And also suddenly we try to go out and do the weighted squats and kettlebell swings and everything, then we get some trauma as well. And disc degeneration, look at the common disc degeneration. In 20-year-olds, it's 37% common. And in 80-year-olds, 96% common, the disc degeneration. So when you if we take X-ray of my back or MRI, definitely I'll have some L2 to L5 mild degeneration. It will show me. Am I going to cry about it? No. I've been active all my life. I'm not going to worry about it. It's a normal thing. I got gray hairs. I'm not crying for that. Same thing. You see how you approach it, right? That's very important. And then you see the knee, very important. I have another slide for knee separately as well. So OA, look at the OA. You have categorized into more than 40 years and also less than 40 years. So almost 19 to 43% of the people above 40 years have OA in the knee. So when you have a knee pain, when you take an X-ray, when you are diagnosed with mild degeneration or moderate degeneration, osteoarthritis, it's not the end of the world, guys. It's not. Definitely it's not. Actually, I have knee pain. I had a medial collateral ligament injury playing volleyball. I healed it. But last season, I played cricket in the league, and I had severe knee pain, a lot of swelling. I thought I kind of twisted and hurt my meniscus. I was in a lot of pain actually, and I couldn't perform well last season. And then finally I took an MRI, and then I found out my medial condyle has bruised because I have a little bit of valgus in my knees. So I got bruised medial condyle. That's what's giving me the pain. So, I just wanted to know what is happening so I can treat myself. And that didn't change. I know what's going on. So I'm going to approach it. So sometimes you need to take an MRI or CT scan to just confirm the diagnosis and keep moving forward, not get stuck there, right? That's a real life example there. And you see in the foot, again, we're going to show a separate slide for ankle also. Morton's neuroma. It's 54% people might have Morton's neuroma. So it's not an unusual thing. And also anterior talofibular ligament, your ligament on the side of the ankle, you have the pathology in 37% of the people. So I just want to, all the findings in asymptomatic people, that means people who live with no pain, no problem. These are the MRI findings. So think about it. Next, we're going to talk about just the knee I told you. Look at this knee, right? They did MRIs of 5,000, almost 5,400 knee MRIs. What did they find? Almost every 1 in 5 people without any pain or injuries have some abnormalities in the knee, right? There's 6,000 scans, guys. So don't worry about it. And the take-home message is, as you see in the bottom of the slide there, some of these findings are normal. You can just go on with your life, consult a physiotherapist, do the exercises, what you need to do, and keep your doctor in the loop, and avoid too much pain medications, and do some healthier way to conduct your life. Same like wrinkles on your skin. So another slide here I'm going to show. This is for imaging of the foot and ankle. So how many asymptomatic foot and ankle have the problems? Let's see a small glimpse. 43% of the runners had little bit of a tibial stress fracture. Until you don't know it, you don't have pain. Once you know it, your brain connects that to that little kind of a stress fracture on your tibia, right? But some people do have pain, they have to get treated. That's why physiotherapists come in. Physiotherapists not just a healers, they are your health coach. They're going to help you with that. Then Martin's neuroma, we already talked about. More than 25% of the individuals have that. And then abnormal ligament, I told you already. And also the lesions in your bone in the back of where the Achilles tendon attaches. 15% people are affected in there too. So look at the slide. Spend a minute on this. How many of you have scans which is showing these things? Does it mean that you have a really big problem? No, you can deal with it. Next is, so the scan's relevance needs to be substantiated with a good history taking. That's where the good physiotherapist comes in. And a clinical assessment to find out what is actually the diagnosis. Is the disc bulge really cause of your back pain? Is a little bit of ATFL or your anterior ligament abnormalities really cause of your ankle pain? Or if your hip stability is a problem for both of them? Or your thoracic rotation is a cause of both of them? That's when a skilled physiotherapist is going to assess you from head to toe and then find out what are the compensatory movement patterns, what are the movement dysfunctions you have which causes stress in the other parts of the body which is giving you pain. It's not just what you see in the MRI alone. So pick up the phone and call the physio. And also we assure you when it is very safe to move and when it's not. So a scenario, I'm going to give you a scenario. Okay, you are, just let's take a 40-year-old male and you got injured when you played baseball when you're 20 years old, right? And then you didn't care about it, it all healed up, then you were very active, you're busy, then you got into work, university work, and then you got a sedentary job and you couldn't move much and you worked on it, and suddenly one day you went up, you lifted a bike in the garage and immediately you got shoulder pain. Then it didn't go away for a couple of weeks, you go to the doctor, you get anti-inflammatories and painkillers, then they refer you for the ultrasound. Ultrasound shows a partial tear of the supraspinatus tendon. Do you think it happened just when you lifted your thing? It could have happened when you played baseball, when you had that incident 20 years ago, but you never bothered about it, went on with your life, right? It can show up now. Are we going to relate your shoulder pain now to this tear? Do you think it happened now? So there's a lot of correlation like that. And that's when a physiotherapist comes in to test that and make sure, despite of the partial tear of supraspinatus tendon, we can recover people to the near normal functional level. There's so many partial tear patients we have, and then they're all going back to a normal lifestyle despite the tear. It is possible. Not all tears need surgery. That's a small scenario I want to tell you guys about. And also I want to share with the real patient story with you guys also. It's a very powerful story. I always tell this to my patients. I had this patient maybe 3-4 years back. He's a great person. Let's call him John Smith. He's a financial advisor, a busy lifestyle, and 3 kids, and very active. And he walked into my office because referred by one of my other patients. And he was very depressed, very dull. I was taking his subjective history and everything. And when I talked about his problem, the first thing he did is he took his phone out of his jacket pocket and opened his photos and showed me the scan of his lower back. Giri, look at this. Look at this, the disc degeneration. Look at the disc bulge. Look at this osteoarthritis. This spot. This is what giving me that pain. I told him, how often do you see this photograph? He said almost every day. The first thing I asked him to do is to delete that picture. That's where we started our treatment. We deleted the picture in front of me. Then I started educating him about the scan, about the pain neuroscience education, how the pain perceived in the body. Pain does not mean tissue injury, and how the brain and pain are connected. If you want to educate yourself more about that, I have 2 episodes already in the archives in our physioshow.ca. Go visit and watch it. One is called Pain 101, other one is called Pain, Brain and Dim Sum. Like, it's 20 minutes, watch it, you'll understand the pain better than ever before. And it helps a lot of our patients. Okay, so coming back to the story, we deleted the picture, I started treating him, and then in 2 weeks his pain went down from 8 out of 10 to 4 out of 10. In 4 weeks, no pain at all. He was taking very strong painkillers. We took him off all of that, and he was educated, he was empowered, and he can move. He knows he can move, he knows how to handle pain. He is again back to golfing and enjoys his life. And also he built a property somewhere in Mexico. He goes back and forth now and is having a happy life. So my treatment started with deleting that picture from his phone. So if you have a picture in your phone about your MRI scans, delete that, talk to your physiotherapist, he will guide you what is right and what is not right, and do not have that fear of movement, and you can move. We are built to move. Okay? I hope this presentation opened some eyes and gave you some information. And if you like this, share it with your friends who are in the situation, who are dwelling in the scan and then crying about it. Educate them, empower them, and free them so that they can get ready to get better and get moving for the summer coming up. Okay? Until I see you next time, bye.